It's my pleasure to introduce a dedicated family nurse practitioner with over 15 years of experience in internal medicine, providing care to both pediatric and adult patients. She holds a master's in family nurse practitioner from Long Island University and
You have some information. Oh. Okay, I guess our next speaker is already online. Okay, good afternoon, Dr. Miss Joelle.
Here.
Hello, Miss Joelle. Good morning.
Good morning. Are you able to hear me?
Yes, loud and clear, Miss Joelle.
Okay. So I'm trying to get my presentation, but it is not loading.
Can you please share your presentation, Miss Joelle?
Sure, I'm trying to do that now. Are you able to see my screen?
We are able to see you, but your screen, we are not able to.
You're not able to see it. Okay.
Would you like us to share from here, Miss Joelle? Or
Are you able to, if you're able to have it, yes, that would be great.
all right.
If you
A
have
few
it.
students- So Mr. Ray is now sharing your presentation from here.
Okay, perfect. You're Mr. Ray, you could start it. So hello everyone. Today I'm going to be talking about AI in nursing, current and emerging trends. You could do the next screen. I will be talking about artificial intelligence of the future, AI, start to present, AI in nursing, types of AIs, the subsets of AI, current AI-driven trends in nursing, concerns, benefits, and improvements and solutions. You could keep moving. Next slide. Thank you. So I know everybody knows this by now, but the founder of artificial intelligence was John McCarthy, and he defined AI as the science and engineering of making intelligent machines. Next slide. Oop. You might have to go back a few slides. So this is the first question. If you're unable to scan it, that's okay. True or false? Global healthcare spending on artificial intelligence alone will reach $36.1 billion US dollars by 2025. Is that true or false? Anyone could just shout out. So it's actually true. 36.1 billion US dollars by 2025. So a little bit about myself. My name is Joelle. I've been a registered nurse for over 15 years, family nurse practitioner. Here's a picture of me and my family. And I'm from New York in Queens. Next slide. Oh, gotta go back a little bit. So I'm just going to do a little history about AI. In the 1950s, we know Alan Turing described the Turing test, which was an experiment to test machines' ability to exhibit human intelligence and behavior. In the 1960s, the robotics was introduced. Shaky was the first robot to move and perceive and reason about in its surroundings. In the 1970s, Stanford University developed Mycin, or eMycin. It was a program to diagnose blood infections based on symptoms and tests. 1980s, the University of Massachusetts released DX Plan. This was a clinical decision support system, or a CDSS, which I'll go into a little bit later. Next slide, please. When we get to the 1990s, AI is first seen in nursing in the United States. The nursing schedule model was used to improve nursing scheduling. In 2007, you have IBM Watson, and clinical decision support systems was introduced into nursing. Fun fact, IBM Watson won the show Jeopardy in 2011. In 2010, we see predictive analysis. And in 2020 to the present, we see the rise of machine learning and deep machine learning, predictive analysis, generative AI, and clinical support systems that allow AI to thrive in nursing fields. We're starting to see virtual nursing assistants, AI robots, and more. Next slide, please. So there are types of AI we use every single day, and it's perfectly integrated in our everyday life. Next slide, please. So, for example, Amazon, Netflix, they use non-generative AI, which basically means it is rule-based, and it suggests things that you like. It doesn't create any new content from scratch. Then there's generative AI that creates new content from scratch. And some examples are GPT-4, CDSS, and nursing simulation. We have large language models, which identify patterns in the text, and they generate a response. For example, ChatGPT. We also have natural language processing, which uses machine learning where humans interact with computers. It extracts keywords and generates a response like a chat box or an electronic health record. Next slide, please. So machine learning, why is it so popular? Machine learning is scalable, adaptable, and versatile. Next slide, please. And now we see with machine learning, there's deep learning. Deep learning is something that's coming up more in AI. And we also have predictive analysis, which uses machine learning, data, algorithms to predict future outcomes based on historical data. Next slide, please. Clinical decision support systems, they're often used in nursing because it improves decision-making, enhances patient care, and increases efficiency. Next slide. And lastly, we have prompt engineering, which is also used in nursing. It's a tool that you give a prompt and the AI system would give you a result. Next slide. You can go ahead. You can go to the next slide. And the next one as well. So nursing and I, from 2020 to present day, as we all know, COVID-19 catapulted the AI game, especially in nursing. We now are seeing companies like Microsoft creating virtual nursing assistants. They're actually in the process of working with ambient AI, which is basically a nurse would go into a room, have a natural conversation with a patient, and the ambient AI would pick up keywords, and at the end of the conversation, be able to come up with a result or come up with a clinical plan for the patient without having the nurse having to document. And last but not least, AI robots. Next slide, please. So here are some current AI-driven trends in nursing. I'm just going to go over a few. Feel free to go to the next slide. Oh, go back one slide. Sorry about that. Yeah, it's a little glitchy. So Kate, which was mentioned as well in another presentation, is the knowledge automation through expertise. It's a patient triage system for the emergency room. It uses clinical decision support systems. It's a real-time clinical information. It gives real-time clinical information on patients and also helps with nurses to triage, which in turn helps with workload. And it also is great at getting higher risk patients to the appropriate care. Next slide. Rothman Index is an algorithm that detects the patient's condition in real time. It uses predictive analysis. At the end, it calculates a score and it's able to tell clinicians how the patient is doing overall. So the Moxie robot is meant to help and assist nurses. It delivers medication, could deliver labs, deliver PPE, and one of the biggest things is that the cost, as you can see, is $11,000 a month for the robot. Next slide, please. And lastly, we have prompt engineering. This is a tool that nurse educators can use, a way to create lesson plans and assignments for nursing students. This prompt that you see on this screen was actually taken from the American Nursing Association. So feel free to take a screenshot. When you're using prompt engineering, it's great to have a template to get the best result. So for example, if you're a nurse educator and you have the nursing students, you're teaching about a certain topic, you want to start with the task, the role, the audience, content, and instruction to be able to get the best possible outcome. Next slide, please. Oh, it's okay. It's okay if it's so the question was, what are some of the concerns that are happening with AI? Basically, AI has a huge risk for bias and being subjective. Um, as one of the presenters mentioned, there's a fear that it's going to replace nurses. Um, and there's a lack of framework for nurses specifically and its ethical use. And one of the biggest concerns with AI is that nurses are actually often excluded from early analysis, development, and design stages in when using or creating programs for AI. Next slide, please. Next slide. So some of the benefits of AI, which we've been talking about, are that AI actually includes some life-saving possibilities. It helps with nursing workload, and it also personalizes care. So, thank you. We can't talk about AI without mentioning its ethical use. Um, the American Nursing Association actually released a statement on their position on AI. They made it clear that AI does not replace a nurse's decision making, judgment, critical thinking, or assessment skills. Nurses must understand the specific devices and applications that they're actually encouraging their patients to use. Um, and it's essential for nurses to be part of the team. How are they advocating for the use of AI? Is there AI governance? Is there an AI governance framework? And nurses should also be included in developing the regulatory guidelines. Next slide, please. So as with anything, there are some improvements and solutions. Specifically for nursing, nursing departments need to create a nursing framework that nurses can feel comfortable to use when it comes to AI. Nurses should be trained on terminology and technologies. They don't necessarily have to become get a master's in nursing informatics, but they should be aware of what AI is offering to them and their patients. It's important to develop guidelines. And I'm going to talk a little bit about Tiger, which is Technology Informatics Guiding Education Reform. Next slide, please. I'm not sure how many people actually have heard of Tiger, but it's an internationally recognized recommended framework on how to integrate informatics and technology into healthcare education and practice. It's specifically created for nurses and healthcare professionals to help develop knowledge and skills needed to use it effectively in healthcare. Feel free, next slide, please. So Tiger actually focuses on 5 nursing roles. Each nursing role has 10 competencies. The nursing roles are clinical nurse direct patient care, quality management, coordination of interpersonal care. Next slide, please. Nursing management and IT management in nursing. Next slide, please. Just to give an example of the 10 competencies that Tiger suggests, nursing documentation, including terminologies used in AI, information and knowledge management, principles of nursing informatics, data protection and security, ethics and IT, information and communication systems, quality management, decision support, telehealth, and assistive technology for aging people. Next slide, please. Some other improvements and solutions, very important for the nursing profession. Nurse educators should increase their knowledge and comfort levels with concepts and basic concepts of AI through courses and workshops. Research also suggests adding nursing informatics into the nursing curriculum with courses that include data literacy, technology, systems thinking, ethical implications of AI, analysis, and implications of big data sets. And nursing leadership should also incentivize nurse educators to adopt the need for changes in nursing curriculums to prepare nurses and nursing students to use emerging technologies. And lastly, most important, nurses should have a seat at the table when it comes to AI, and play as role co-designers in AI technology in healthcare. And that concludes my presentation. If
That
any
was
questions,
a really enlightening presentation. And we are going now to address. There are two questions for you from our attendees. So the first question, one concern with AI in healthcare is the risk of bias in algorithms. How can nursing professionals ensure that the AI tools they use promote equitable care and avoid introducing disparities?
that is a great question. As we know, there's no magic wand to really make sure that AI is 100% bias free. But as I said, it's important to have different voices, different nationalities at the seat at the table. So when it comes to creating these programs and prompts, it's important to have a diverse team that is able to give culturally competent information to these programs.
Thank you. And last question, in terms of emerging trends, what AI-driven innovations do you see playing a key role in the future of nursing? And how will they influence the way nurses deliver care?
Another great question. I believe that, as I mentioned, the ambient AI, where you have natural language with patients, with the technology picking up this information. One of the biggest issues, at least in the United States, that nurses have is documentation, right? So we're taking care of the patient, but we're very, very conscious of having to document all the information. As we all know, if you didn't write it, you didn't do it. So the most, what I believe, the ambient technology where you're having a natural conversation with patients, it's picking up keywords. At the end, you have a care plan, which frees up time for the nurse, which gives him or her more time to spend with the patient, less documenting. That's what I see as an emerging trend in nursing.
Thank you. Is there any more question from the audience?
Thank you.
Thank you so much, Ms. Joelle. And
Okay, thank you.
Have a nice day. And